Hello and welcome. I'm Sumaira Khan and you're watching News9 Live. The Union Ministry of Education released the draft guidelines for schools to prevent student suicides. The draft guidelines prescribe a plan of action to address the issue of rising student suicides in the country. The guidelines envision the setting up of wellness teams, orientation of teachers and family members, and immediate response to students exhibiting warning signs. The draft guidelines have been titled as UMMEED, which stands to understand, motivate, manage, empathize, empower and develop. Teachers will be playing an important role and have been asked to undergo orientations once in a year on this subject. The focus is on capacity building in schools to handle crisis situations and identify vulnerable students so as early interventions could be carried out. I'll be joined by a panel where we will be discussing this issue and a host of other issues which are related to these student suicides, how we can prevent them, what are the factors that contribute to it. I'll be joined by Kapil Gupta. He's a CEO, neetprep.com. I will also be joined by Advocate Anubha Srivastav Sahai. She's an educationist and President IWPA. I will also be joined by Mimansa Singh Tanwar. She's a clinical psychologist from Fortis Healthcare. And these guests will be discussing with me this whole issue that are related to these student suicides. So first and foremost, I would want to come across to Anubha you. Anubha, these guidelines that have been put forward by the Education Ministry, how helpful would they be according to you in the student suicides that we've been seeing in the increasing numbers?
Yeah, thank you for having me here, and it's a very important discussion, and it's good that you have taken up this issue. And earlier also we have discussed on several occasions. And I'm really grateful to the Government of India and Education Ministry that they have come up with this guideline, such guideline to meet. And we have been insisting, requesting the government and other authorities also to take this matter seriously, because students are under a lot of pressure since past 2-3 years. I'm seeing after COVID, especially, students are under a lot of pressure, mental pressure. There are other societal pressures also, peer pressure. So that's why this whole guideline, that is UMMEED, will really help all the students, not only the students, even parents and teachers, because even teachers are also struggling with this problem. And since there was no proper guidelines in place, even the Mental Health Act is in place, but that also needs proper implementation. But as far as schools are concerned, as far as coaching institutes are concerned, I think coaching institutes, they have not included in this guideline. That's right. It's a draft guideline. So we will be giving recommendation to even include coaching institutes, because most of the suicides are happening in coaching institutes, especially in Kota. If we will include other institutes also apart from school, not only school, but other institutes also, where there is a lot of pressure on students, particularly board students and those who are for NEET and JEE. So definitely the coaching institutes, if they will also get some kind of guideline, they will also implement it. So it's a welcome move. I'm really thankful to the government that they have come up with this guideline. And slowly and steadily, we will definitely do better once all the guidelines are in place and implemented.
And you did rightfully point out that the students are under a lot of pressure, under 18 students, but students who go on to these coaching institutes, they are under immense pressure. So how do we bring them into the ambit of these guidelines, and can there more be done there? Kapil Gupta is also here with us. Kapil Gupta, what do you think, and should more be done to bring in these coaching institutes, these private institutes where these students are there? Because we see a lot of pressure is on students after they cross 18 years or they're preparing for these entrance exams. So how do we bring them into the ambit of these guidelines, or maybe a different set of guidelines for them?
Yeah, probably something needs to be done there, because I think part of the problem just comes out of the fact that along with school, going to a coaching and dealing with the pressure of a competitive exam like JEE or NEET, probably is the starting point of a lot of problems, which ultimately for some students, unfortunately, leads to suicide. So working with coaching institutes, working with those setups, I think it's very, very important. A lot of suicides which we have seen recently have happened in Kota. And some practical guidelines around there, restricting age limits in terms of from what age students can really come there, making it mandatory that one of the parents should accompany students or a grandparent or some cousin, etc., for the duration of coaching. Those are some of the things which can be done, but I think right now, acronym apart, it looks like a set of good to have set of things which should be done, how much impact these would have, because like it or not, we don't like to talk about mental health issues. It seems like communication is that the person has some he has some mental issues, but mental health is a serious issue. I talk to people, they tell me there is a mental health pandemic in the country at all age groups, but no one talks about them. So I'm not sure how this whole guideline. I'm very skeptical of guidelines per se. How much will they translate on the ground? I'm not sure. So that is to be seen.
That's a very important factor that you brought in, that mental health issue, and we as a society do not want to accept it, or we do not address it at the right time, and that is very important. Also, Anubha, I was looking at this report, ADSI report from 2021, which says that 58% under 18 students committing suicide, 58% is due to illness, which is in the category of mental health issues. So 58%, which is a huge number. Only 8% is due to failure in exam, whereas 30% is due to family issues, family pressures, or not being able to cope up with the family problems. So 58% is mental health issue. Are we as parents, as a society, accepting the students which are below 18 years are facing such a huge mental issue problem also?
Yeah, this is a very serious concern actually, and since I'm connected with a lot of students, and many students tell me that their parents are not supportive. I keep insisting that we proper awareness. Come up with a guideline, and WHO has issued a notice also that excessive use of mobile phone among children is a mental disorder. And since last 3 years, we can see that kids are now, most of the time, they're using mobile phones, be it for their education purpose or even for other purposes. They're using mobile phone. They're mostly on a mobile. So we have to bring awareness among students, among parents also, that this is also one of the factors. And parents are not understanding that their children are going through a lot of mental stress. They take it very easily. So counseling of parents is also important. If the government has come up with this guideline where they are setting up a committee in the school to take care of this issue. So I think, like we have PTA, Parent Teacher Association, in every school. So every parent should be a part of this committee also. There has to be regular meetings, maybe monthly or quarterly basis, so that parents will also get to know where his or her child is standing, what mental pressure or problem he's facing. Because parents take it very lightly, and students, they're not able to understand what problems students are facing.
We are not ready as parents to accept that this is a big issue, and there are many factors that contribute to it. We can also talk to Mimamsa about it. Mimamsa, when we talk about suicides in students that are below 18 years, what are the major contributing factors? And we as a society, we were talking about this before you joined us, that that we are not ready to accept that mental health issues are a big problem, and students and young kids are facing them. So how do we address that? And do these guidelines address it?
So no doubt about the fact there are multiple social, emotional, and developmental factors that comes into a child's life. So whether it is academic pressure, whether it is peer influence, whether it is media influence in today's time, whether we look at pressures that come from society, whether there are self-related issues, self-confidence, self-esteem. The key that we need to understand is that yes, while these things do pose a stress on a child, it's when a child is not able to find a space to be able to seek help and recognize that yes, this is something which is also impacting me, my mental health, and various other aspects of it, is when children in an a lot of stress when they come under it is when they resort to certain measures, because they may feel that sense of helplessness and hopelessness that comes along with the aspect of where to seek help and who to talk about, and which is where they may have reached out to maybe some people, whether it is parents or an adult, but the lack of awareness that it could also be a mental health related concern still continues to persist. There is no doubt about the fact that in schools and even in general in society, we see there has been a lot more awareness to what it would have been years ago on mental health. Yet, to be able to reach that last mile, we need to keep continuing to take the right steps. So, awareness programs in schools, mental health curriculum in schools, because mental health education, along with various other things, need to certainly be the core aspect of a school's principle, which also means that training for teachers to be able to identify the signs, training for parents to be able to identify the symptoms, and to be able to recognize when is it that the child requires help. The very aspect of help seeking needs to be looked at as a life skill for students in today's time. It's because they do not reach out for help at the right time is why we see what we see as an outcome, which is absolutely preventable. Suicides are preventable, and that's what we need to understand. All we need to do is have the right information, recognize the signs, look at various forms of support systems, whether in the form of parents, teachers, counselors, helplines, for students to be able to reach out. Because in those moments when a student is able to build that connect and reach out to a support system, it prevents a lot of other things. And yes, life skills at large certainly gives children and students a lot of healthy ways to cope with things. But life skills, mental health education, it all needs to come in as an integral part of the education system.
Education system and curriculum and school programs. But very important point that Mimantha was pointing out, and these guidelines, Kapil, I would want to talk about the fact that making teachers the stakeholders, making school also a stakeholder, would that help, or would that change the present scenario, the present situation?
You said right in the beginning, some of the data I was just capturing, 30% of suicides happen due to family problems.
Family issues.
Obviously, teachers cannot impact these 30% of the things unless, as Himantha said, it becomes part of the curriculum. There are specific classes. She said a very interesting thing, which I would like to quote: help seeking should be treated as a life skill, right? In general, it is assumed that when you seek help, you would be considered weak. And that lies at the core of a lot of problems with respect to mental health. So teachers, I can say, can play a role from the perspective that a lot of students look up to their teachers. In general, they have a special place for them in their hearts. They have a special reverence for them. And if this comes from them, this confidence that it's okay if you're not feeling okay, but you should come and ask for help. You can talk to me, or you can talk to this individual in the school or in the coaching. I think at some level, there is a momentary lapse of reason when an incident like suicide happens. It's not something is building up in your head. You have secluded yourself from your environment. You're spending a lot of time thinking. You're not getting up properly. You're not sleeping at a proper time. And if you could talk these thoughts with someone, if a teacher can talk, great, or if there are designated people in schools and coaching, that definitely can help. And teacher
so they can identify that a student is having problem, because maybe they're not able to tell their family or communicate with them. But teachers, if they are trained and according to these guidelines, they will be given these orientation every year. So would they be then able to better handle these students which are having mental issues? Do you think that they would be better equipped?
I hope so. I think starting point for any of this change is just we start talking about it when a guideline like this comes up, and when government centrally starts pushing that, okay, start accommodating this as 1 or 2 periods in a week's classes, then conversation starts. To start the conversation, teachers need to be trained. So teachers need to be trained, so that important stakeholder is now aware that this is something that they can talk. Like, for example, sex education. There are problems there. If you don't talk, then it never is part of the conversation. Similarly, mental health, if there is specific guideline that yes, there has to be conversation around it, there have to be design interventions around it, there have to be ways through which we can capture it early, sure, it should make an impact.
Anubhav, since we were talking about the issues that are related to the problems that students face, which is one, family issues. So obviously the family needs to address those issues, and which can be varied. The parents need to accept the fact that my kid can have a problem, our family issues can be related to these issues. Also, here the figures say that only 8% is due to failure in exams, but students which are above 18 or nearing 18, which are going to these coaching institutes, they are under immense pressure. There are these figures which say that in the past 10 years, there has been a 70% jump in the student suicides. 70% jump. What is contributing to that?
See, last 3 years, what I have been insisting and requesting that since last 3 years, children were at home. They were sitting at home. They could not meet their friends. Most of the students, even with whom I am connected, the more pressure on the students was basically for that they were not having any kind of social connect. So that is one of the reasons that once the schools reopened and the children were very happy. So this is one of the major factors where the students were isolated. They were sitting at home. They were watching mobile phones. Again, mobile phone addiction is a major factor which contributed to such mental issues which children are facing today. We have to come out of this. So we have to introduce a lot of activities in school, at school level. Not only school, in coaching institutes also, students should be trained how to face such problem. You need to talk with the students. Nowadays, students, they don't generally discuss their problems with their parents, even with their teachers. They discuss all these problems with their friends. So we have to be like their friend, even if it is a teacher. Sometimes teachers are very strict, so many students, they don't speak up even if they are facing problem. So once we have proper teachers who are trained, and then definitely the suicide rates will come down, because the students will share their problems, their issues with the teachers. Parents will be counseled. Once the parents will get to know that yes, all these are the guidelines and which we have to follow at home also. These are the signs which they will notice, that if a student is sitting quietly at home, the child is not talking much, then whom to approach. Even now, parents, they don't know where to go. Many parents approach me, they tell me, where should we go, whom to approach. They are not aware of this. And so awareness is must. Now, since we have a committee, we will be having a committee in place at school level. So definitely parents will also approach the teachers and that committee also, that my child is facing such issue at home. And through all this awareness and all this, we need to have a lot of talk on this mental issue. Students should be very confident that no, this is not something very serious. We can come out of this peer pressure or mental pressure, whatever you are facing. And there are a lot of things which needs to be implemented at school level, at societal level. It's not that the teachers and parents will only be able to handle this situation. Government will bring guidelines, but government alone will not be able to do it. All the stakeholders, even media plays a very important role. Parent-teacher association and parents, and apart from that, even society, the friend circle, a lot of people are there who need to come forward. A lot of NGOs, Child Rights Commission, all stakeholders need to come together to fight out this problem, to resolve this problem. And definitely, I'm 100% sure that
this is one step where we have acknowledged and we've put forward these guidelines. The government has done that, and now all the other stakeholders also have to come forward and work towards it.
It's like a taboo these days to discuss anything related to mental issues.
Parents want their kids to have 100% in everything. They want them to excel in all the sports, music, activities. They don't want to accept that my child can have a problem or a mental issue. I think that there is a big societal problem also that we are facing. Mimamsa, do you feel so? Because we are, as a society, we are looking at, our kids should excel at everything. They are nowhere below 95% or 96% in exams, in extracurricular activities. There are multiple activities that they've been put through, singing, music, sports, and they hardly have time, and whatever time they have, they are glued to their mobile phones. So are we ready to accept, and how do we change this this societal pressure that we are putting our kids into?
See, I think what we need to understand over here, one, very clear that teachers and parents are the first responders for any child when they're under stress. So absolute awareness and training for teachers and parents to understand what is mental health and what are mental illnesses. I think both the things are two very different aspects, obviously comes under the same umbrella, but mental health would include what? Simple conversations about how are you able to manage your exam stress? Are you able to take enough breaks? Are you able to practice digital detox? Media literacy, how to filter the information that comes in, how to not allow the media pressures to get a child into a conformity, to follow a certain trend, and other pressures and comparisons that the child may feel. Academic pressures, it's not just merely parents or teachers. Sometimes a child may internally also feel academic pressures with the entire competitiveness that is there in the environment. So how can we help the child manage that pressure and deal with that competitive environment in a better way? Similarly, whether they are able to have adequate sleep, are they doing their extracurricular activities? These are some basic things that we need to make as a significant aspect of a child's or a student's life. Because unless we don't focus on the significance of these, to be able to not allow the pressures of their day-to-day to overwhelm them, and how can they sort of navigate through these things? This has to come through schools, and school is the place where you have this larger audience of both teachers and parents who are a significant aspect of a child's ecosystem. So when they are aware, and when students are also aware through a curriculum in an educated form, we talk about physical illnesses. Why not also talk about and normalize the conversations around mental health, which are required as a part of the larger segment of other things that we talk about in our education system. So we need to bring that element of normalization, having more conversations, easily a student feeling the ease and the comfort to go up and talk to a teacher that I'm not feeling emotionally too well today. Can I have some break? Can I talk to you? Or maybe can I go to a counselor, without feeling the sense of judgment, insensitivity, labeling that has been a part of the stigma that has been associated with mental health for a very long time. So absolutely we need to destigmatize mental health issues. We need to also change our language, the way we talk about mental health. All the words that we would use, and the guidelines have also come up for that, where even in the guidelines you would see that how we need to address people who are struggling with mental health issues so that it doesn't get labelized on anyone. It's not an identity, it's an illness that an individual is struggling. So whether it's a student, a child, or an adult for that matter, it needs to be looked at as an illness which is external to them and requires help and treatment. Absolutely. So reaching out to mental health experts, but again, looking at the dearth of mental health experts, every time there is a problem and going to a mental health expert is not the solution. The solution is that we bring more awareness, we bring destigmatization, we increase sensitization, and we change the language. We bring in life skills again in the way that I just picked up in simple form that students are unable to do. Because ultimately, what are the changes that you see? You see changes that a child starts to isolate oneself. So that isolation in itself creates that barrier for a child to not be able to go up and talk to someone. So social isolation is something that you would see. You would see sleep disturbances. You would see performance-related concerns. You would see mood-related changes. You would see anxiety, sadness, irritability. All of these changes as a sign that yes, this child requires help. And as a part of the larger society, we need to also practice psychological first aid, which is about recognizing these signs, giving that safe space, an empathetic safe space to a child to talk about their issues without interrupting, without putting our advices and judgments before a child is able to feel that, yes, I've been able to connect and talk about whatever I'm going through. And then, yes, looking at what are the effective support systems that we can build for the child.
Important point that we all need to be basically trained in basic responding or how do we respond to an issue if we see one. teachers and parents, they need to have that basic training, I think. And here in these guidelines, the teachers have also been made a stakeholder, so they would be having those orientations. The parents also need it. But I would come back to a point that I earlier raised, and Anubha said that the increase in numbers that we see, I feel that they are very alarming. In the past 10 years, in 2011, it was 7,969 students that committed suicide in a year. In 2021, it's 13,089. There's a 70% jump, couple. Do you feel that the education system, or what is the pandemic that we all faced, is contributing to this, or there is more to it? And what are the factors that are contributing to this jump during the past 10 years? The education system has changed, more competitive exams, everything is a competition these days. Is that a contributing factor, or there are other reasons? What do you feel?
So I think one part I'm absolutely convinced about is that internet has brought in a lot of, if you will, ambition and dreams. Earlier, the information which used to be, if you will, siloed to wherever you were, you would have access to information of up to 20 kilometers or what was getting published in print. Today on internet, when you go on YouTube or you're on some news site, you can pretty much go anywhere, and you start building up an ambition that yes, you can also crack IIT, you can also get into a government medical college, and irrespective of what your interests and what your capabilities are. Now, follow up that thing with actually trying to achieve it. Some would be able to, some would not be. There is a basic restriction with respect to number of seats which are there in these top colleges. And that brings in, if you will, a level of frustration. So I got aware, I tried doing it, I couldn't do it, and then it builds frustration. So I think part of the problem just comes for good or for bad reasons. Some people would say in this situation, probably ignorance would have been bliss. I'm sure in 2011, the amount of internet access which existed is much less compared to what exists in 2001. And that ambition which is getting built all over the place, wherever you are, what situation you are in, no one stops you from dreaming. And that then leads to a situation where you are not satisfied with what you're able to achieve, and that brings in a level of frustration, which in my mind ultimately it's a dangerous situation. There is no way to restrict information which is available on the internet, and I'm not talking about vile information, just the information like how much salary a graduate from IIT Delhi is receiving right after college at age 21. Now that brings in a set of dreams, set of ambition. How do you satisfy it for everyone? And those who find themselves in a situation where they have worked very hard would still not be able to get to a college, end up losing hope.
And if I bring this back to you, Mimamsa, once, and then Anubha, I'll come to you. Mimamsa, these guidelines are for students that are below 18. So schools have basically been brought in to the ambit of these guidelines. But then we were talking earlier also that there are coaching institutes. These are students just out of school and yet not in a proper college or university, where there might be these student counselors or where they can access help. How do we bring in these coaching institutes into this, into these guidelines and their ambit? Because that is also a big factor. We've seen how students in Kota are committing suicides left, right, and center, and they are not able to cope up with the pressure that is there, and that term has been given, no, that pressure cooker that they've been put into.
No, absolutely. I think there is no denying of the fact that the mental health pressures are not just about, I mean, schools is one aspect. And of course, because of the critical years, the young years where we can instill a lot of life skills in students, given that they spend a significant amount of time in schools. But it needs to also look at it as a continuum of life as a longitudinal axis. So along with schools, coaching institutes, even colleges, because over there we continue to see that students do have pressures, whether it is academics, whether it is relationships, and many other factors for that matter. training of even people in coaching centers, and where is it that they can sort of guide and refer their students wherever they require help, and helplines. I think it's very important to look at two aspects, and COVID has certainly brought in a very positive change in that sense. Telemental health is something that has been a boon during this time period, and people from remote areas have been able to access help. It's just we need to be able to understand that where to reach out. Telemental health helplines, these are two important aspects that we need to start disseminating as an information, that it's available to reach out for help. It's absolutely okay to ask for help, and this is where it gets down to. The moment we bring in the normalization of yes, it is okay to ask for help, help seeking is absolutely fine. If you can seek help for perhaps an assignment, or because you're getting bored and you just pick up a call with a friend and you just say, let's do something, that's also help seeking. So if help seeking can be seen in that sense, why not seek help when you are struggling emotionally with something? And which again, telemental health helplines should be included even in the education system when it comes to colleges, coaching centers, because that certainly bridges that gap that has been there in the accessibility for a very long time. So awareness, acceptance, and accessibility, these are the three things that in the part of the guideline across institutions need to be looked at along with the training.
Anuma, also one factor that we encounter time and time again is that do we have sufficient number of trained professionals to help? Because when we talk about these mental health issues about students or otherwise also as a society in our country, do we have sufficient number of people out there to help you? And what can we do to increase their numbers or make it more widespread, more acceptable?
Unfortunately, see, in our country, we don't have people to look into this issue. We have Mental Health Act in place since 2015. It's more than 5 years that the act has been enacted, but implementation is almost zero at ground level. There has to be a central mental health authority, and at each state level, there has to be a state mental health authority, state level mental health authority. But that is nowhere in place. Nobody knows. Nobody is aware only. People don't know whom to approach. So we need people. We need more people to join this movement. I would say UMMEED should be treated like a movement. If government has come up with a guideline, it's a guideline, no doubt. But since we have an act in place, so why not make it like a movement, so that all the stakeholders should come forward. Now we are starting from school level. We are starting to implement these guidelines. So we should connect the schools with the education department. Education officer of each district should also take cognizance if any case is reported. Apart from Child Rights Commission, they have this act in place where the Child Rights Commission is also they play an important and major role. So the district education officer, right from Zilla Parishad and from small village also, we should start this implementing. The education officer of that particular district should coordinate with the schools. Then from again, in each district, we should have all the authorities in place. They should do proper checking of the schools. From school level, once we start this awareness and also implementation, if the implementation will happen, once the teachers are properly trained, education officer should be given the responsibility to check whether the teachers are properly trained or not as far as mental health is concerned. And then afterwards, once all the teachers are trained, maybe in 6 months or so, every school should be graded, right from Zilla Parishad to city level school. All the schools should be graded. And we have due dice also. Due dice, maybe there should be some information about each and every school, that they have these number of children, these are the parents, and these students are facing mental issues. They have reported to this, like we have POXO box in every school should have POXO box. Similarly, if we have a proper committee in place in each and every school, where the stakeholders will be parents, teachers, and children, then definitely once we will start right from school level, where the students will be trained how to face failures. Because what happens when the students are in transition phase, particularly, then only they take all these steps. Transition phase, as in once a child moves from school after 10th. after 10th, most of the school, they change their school, they join some other school. They join, most of the coaching institutes have a tie-up with some school. So most of the children take they're in a transition phase after 10th.
Yeah.
And if you will see the report, most of the children who are committing suicide are those who are 16 and above, 15 and above. Those who are in that transition phase after 10th. So they lose their friends once they are out from school. They go, because मुझे students ने ये सारी बातें बताई, those who are in quota, they told me that this is what we are facing in quota. We are coming to quota after 10th or maybe after 11th or 12th. We don't have friends.
No friends, no family, no support system, and just a lot of pressure. Anubhav, if
I
you
would
can
like to just add one more thing over here.
Yes.
Given the fact that, even WHO has established that bullying is one of the adverse childhood experiences that any student can have, and that increases their vulnerability to mental health conditions. I think it's very important to schools to also have a mental health and anti-bullying policy in schools, because this is one of the most common instances that any student experiences. That it continues even in their college years, and one needs to also understand the significant impact on their mental health as a result of these experiences. So along with academic pressures and the other pressures that students experience, even bullying needs to be looked at as a very serious concern when it comes to mental health perspective.
We are just heading towards the end of this debate, and I would want all of you to come up with the way forward. So quick questions. One quick question that I want all three of you to respond to is, Mimamsa, how do we see suicide? Is it a personal act or is it a social act?
I think we need to look at suicide as an aspect of multiple factors. It can't be just one. It is intersectional. There are various factors, whether it is social, family, and various other factors that comes in. But what we need to understand is that suicides are preventable. What we need to look at, identify the signs, disseminate the right information, bring in more awareness, and look at more teacher training, student training, parent training, both in schools and even in the college and other institutions, because they are the first responders. Mental health curriculum certainly needs to be looked at and included in the education system.
So these guidelines issued by the Ministry of Education are a step in the right direction, but that's just one step. We need to do a lot more to make it more effective. Do you agree to that, Mimamsa?
Absolutely. Absolutely, no doubt about that.
Kapil, what do you think about this? That you've mentioned this earlier also, that this is one step that we've taken, a positive step, but there is a lot more that we need to do. What more do you think should be the next step forward, or the other steps that we need to take to make it more effective?
Prime Minister Modi should go on television and say that no exam is worth dying for. And he should have a bunch of people around him who are big people who never went to an IIT or a medical college, and he should tell them, I did not go to an IIT or medical college, I am your Prime Minister. All these folks, Ratan Tata, Mukesh Ambani, Gautam Adani, there are going to be a bunch of people who did not go to these colleges are still doing fine, much better than people who went to these colleges, and build up that confidence amongst people. I think this fact is getting lost in all the noise, that you ultimately get successful out of being hardworking, being at it, being consistent, and not necessarily by going to great colleges. So the halo around these colleges, the desirability around these colleges, the fait accompli which students think happens when you don't get into these colleges has to be brought down. And I think Prime Minister takes up these campaigns very well. He should go at it.
That's an interesting thing that you've mentioned. I'm sure Prime Minister Modi has addressed student issues, exam issues earlier, so he would do this also. Anubhav, last comment from you. What do you think, apart from these guidelines, more can be done at the school level, making teachers, parents, stakeholders? How does that help? Does that change the present situation?
No, not only school teachers and parents. I think all the stakeholders should come forward, and students should be trained right from beginning, like how to face failures. If a student is having any kind of problem as far as failures, and it's not only academic pressure, as one of the panelists was talking, that even relationships. Now the children are into relationship even when they are at the age of 14 years, 13 years. So that is also one of the major concern. And again, so we need to bring in some guidelines, and awareness is very important, where the children will be taught how to face failures, be it academic wise, or there's any kind of peer pressure or any pressure from family, or you are into any relationship and you are having breakups and all. So lot of factors are there which are involved, and even in colleges, colleges should also be a part of this these guidelines, because I've seen recently in IITs a lot of students have committed suicide. So even colleges should be included, and I think it's a welcome move. It's a welcome move where even our Prime Minister is very much serious about this issue. He keeps talking about it when he conducts that Pariksha Pe Charcha every year. So I think he understands that what problem our country is facing. So it's a welcome move and a good start where we all stakeholders should come forward and support each and everyone. Then only we'll be able to come up and resolve this problem.
Do you feel, Kapil, that the most important factor out of all these things, there are many factors that are important, but the most important is that we acknowledge as a society that this is a big problem, obviously for students, and otherwise also as a society we're facing this problem and we need to address it. Once we accept that, probably then we'll find ways and means to address it and find solutions.
No, absolutely. The first step has to be acknowledgement. This whole UMMEED guideline is officially acknowledges it. The more it permeates, more people talk about it. I think the more sensitization around it would happen. You were showing the data, 30% of suicides were due to family problems. It is possible that kid is growing up in a place where parents are always fighting all the time. Right. So once a discussion around it, acknowledgement around it happens, it is a significant step forward. It's not a problem in India. It is a problem all over the world. So mental health matters.
But all over the world, or in most of the countries around the world, they address these family issues also at so many levels. In our country, we do not enter the family space, or we do not say that a student is facing a problem at home and that is contributing to a lot of things. So we keep that sacred. That is also one thing that we need to accept and acknowledge, that that is also a space where stakeholders can enter and intervene. Do you think that?
Correct. Absolutely, absolutely.
Okay, thank you so much, all three of you, for joining us on this very important debate. The UMMEED guidelines do show a ray of hope for the students, that are under 18 years of age and in school. They make parents and teachers a stakeholder. Very important step that has been taken, because there has been this acknowledgement that there's this big issue that needs to be addressed. But yes, of course, more needs to be done. All the stakeholders need to come into the ambit of it and work towards better mental health awareness. Thank you so much.
इंजीनियरिंग कर रहे हैं, जो कि सभी लोग कर रहे हैं.
Coaching is now starting from grade 3, 4, 5, 6.
कोटा जाने वाली बीच राह में आधे टेस्ट देके हैं सिलेक्शन की चाह में.
ऑल इंडिया